Welcome to the Besties with Breasties podcast. Sarah Hall here. I am a certified health and wellness coach, athletic trainer, mom, and breast cancer survivor. I help women overcome their own mind drama to make mind shifts that open up the possibility for their most empowered and energetic life.
And I am Beth Wilmus, author, speaker, and founder of a human investment organization, otherwise known as a nonprofit, called Faith Through Fire. Our mission is to reduce the fear and anxiety that breast cancer patients feel and replace it with hope and a path toward thriving.
This podcast is about our experiences with breast cancer
and life after as young survivors and moms.
Beth, your hair looks nice.
Thank you. Do you like it?
I do.
Yesterday I was a blonde. Today I'm a brunette.
This is like a big change for you. You know what, though? I did you do this because your wig was brown?
I did this because I was bored and I decided that I needed a change.
Boredom.
And
anti-blonde.
It's fall. So I thought, well, and I'm going to be on the news tomorrow. And I'm like, why not just go on with brown hair? I don't know.
No one will recognize you. It'll be incognito.
I know. Nobody's going to know who I am. No, I had brown hair 6 years ago. I like to change my hair a lot. I haven't done it in a while. But so right before when I got diagnosed, I had blonde hair. And then in preparation for chemo, I chopped it all off into a pixie and then I dyed it brown. And then when I got my wig, I was like, well, if I'm going to have to get a wig, I'll get the hair I never had, which was very long, thick, and brown.
It was beautiful.
It was.
Yeah, you had a pretty wig.
I wore it once and then realized this is for the birds.
It's too hot and itchy.
And I ended up wearing a baseball cap basically all the time or a scarf. But yeah, so I was like, well, maybe we'll just go back to that color.
Yeah, it looks so nice.
Well, thank you.
Yeah.
I appreciate it.
I like it.
Yeah. I mean, it's just my life is so mundane now that
This is a big change.
This is exciting for me. It's like
I would say your life is not mundane.
You don't think so?
No.
Feels very like Groundhog Day sometimes.
Really?
Maybe not.
I mean, I think you need to look at somebody who works in an office.
You
and I do not have the same day ever.
No, that's true. That's true. We don't have the same day ever. But I think that's my ADD talking.
Yeah,
I have a very high bar when it comes to like,
you do.
Change,
ping, 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 ping. She's the human equivalent of what's the game where you push the buttons and it
the
flicks
ping pong?
the little... No,
ping
it's
pong.
not.
Ping.
No, it's not ping pong. Paintball. Pinball. Pinball. Thank you.
When two people with chemo brain are trying to talk.
Ping pong. Ping pong. Ping pong. Ping pong. Yeah, that's her. She's just in human form.
Good grief. All right. Can we get serious now?
Yeah, let's get serious.
Yeah. We're going to have a doctor on. We need to be serious, right?
Serious.
So we are going to be talking to Dr. Trina Ebersol, and she is a plastic surgeon and assistant professor of surgery at Washington University St. Louis School of Medicine. She specializes in aesthetic surgery and breast reconstruction. Dr. Ebersol is on the podcast today to talk about aesthetic flat closure. So we've already spoken to a patient about aesthetic flat closure, and we thought it would be really good to follow that up with a doctor in St. Louis that's performing the procedure.
Yep.
And aesthetic flat closure is just a form of reconstruction surgery for women who opt to stay flat after breast cancer and want a very smooth, contoured look after their surgery. So today we're going to talk about aesthetic flat closure, what it is.
We're going to talk about barriers to receiving AFC or aesthetic flat closure from surgeons or plastic surgeons.
And then considerations for the procedure and how to feel empowered to find a surgeon who can provide you the look you desire. So before we do that, let's hear from our first sponsor. Hair loss is consistently ranked as one of the most feared side effects of chemotherapy treatment. The emotional impact chemo hair loss can have on patients has been well documented. Scalp cooling is a simple treatment that can prevent hair loss caused by certain chemotherapy drugs. The use of scalp cooling is proven to be effective in preventing chemotherapy-induced alopecia and can result in people retaining much of their hair. Paxman is the global leader in scalp cooling. Their cold cap is scientifically proven to reduce hair loss during chemotherapy. If you are facing cancer treatment and concerned about losing your hair, ask your provider about scalp cooling and visit our website at www.coldcap.com. All right, and we're back. Thank you so much, Dr. Ebersol, for being here.
Yeah, thank you guys for having me. I think aesthetic flat closure is actually a pretty common thing that a lot of women ask for, but people
That's
don't know.
amazing because I'll be honest, I had the hardest time finding a plastic surgeon in St. Louis who was saying that they did them. So
I
I'm
was gonna say, I feel like a lot of people don't necessarily talk about it though, for whatever reason.
really okay. Well, I was thrilled when I found out you do this surgery and could come on and talk about it. So, can you kind of explain what aesthetic flat closure is for women that maybe aren't familiar with it?
Yeah, and there's a lot of women, I think, as you guys know, and your listeners know, it's a personal decision, and women come to the office for different types of reconstruction. I think just knowing that it is an option is something that many people don't necessarily realize when they come in to see. I think just because you're getting so much information from so many different doctors. So just knowing that it is an option in terms of your reconstruction after the mastectomy. So basically, it's not just a closure because once they do the mastectomy, even for different body types and chest types, you'll have different amounts of excess skin. And so basically, an aesthetic flat closure, the goal is to achieve basically a flat contoured look and kind of delineate the skin that way. I think most plastic surgeons do offer it if it's what the patient wants, but there's still a lot that goes into creating the look of the aesthetic flat closure. And from patient to patient, that's a little bit different. And you can still get it even if you have had implants or a different type of reconstruction and you decide, later for whatever reason you don't necessarily want that and want an aesthetic flat closure. There's just different considerations that go into that versus if you do it from the get go. I think that's something that's important to know about. The other thing that I also think is important is that your breast before the mastectomy kind of camouflage your chest shape and your sternum to a certain extent. And so when women come in wanting an aesthetic flat closure, oftentimes I just kind of warn them a little bit. I kind of take a look at their chest wall itself, like underneath the breast tissue, as best as I can. And sometimes they have what we call pectus excavatum or perinatum that's kind of camouflaged by breast tissue. And the reason I bring that up is it's actually fairly common that your chest and sternum area isn't totally flat, but it's actually a little more angled than what people expect. And so you can change the skin and kind of the thickness of the skin to a certain extent, but you can't totally change the underlying bony structure. So that's just something to know. And the other thing is, most breasts, as I'm sure you guys have heard, are they're quote unquote sisters, not twins. So they're similar, not identical. And that also becomes more apparent during an aesthetic flat closure. But there's things that we can do to try to make it definitely more symmetric and things like that. And there's different papers about it, but one of the things to make it more flat and less loose skin is we kind of try to make the fold of your breast become more flat or kind of what we call obliterate it, but basically make it more smooth with your abdominal skin. And the other thing is kind of make the central area more flat and the lateral area more flat as well.
I think what you're saying is really interesting because I think that it's really nice when women are set up for
Success.
right? And success can look like just having a realistic expectation of what
To expect when they wake
what
up.
to expect when they wake up, right? So I think that
Yeah.
that's so important, and I think that goes a long way with women that are experiencing the trauma of breast cancer. It's just there's so much unknown, right? And so
Yeah.
anytime you can set them up by saying, here are the things that we might encounter, here's how your chest wall could affect what you're going after, it's going to feel like they're part of the process and not just kind of this victim, right, of circumstance. So I think that's so critical. And I really appreciate you going into the different anatomical differences in women's bodies because not everybody's going to look the same. And so I think that's really, really valuable to bring up. What are you seeing in your practice and regarding women that want to go flat? I mean, is it or I mean, just generally speaking, because it feels to Sarah and I like more and more women are looking at this as an option than reconstruction, more so than in the past. Do you see that as well or no?
Yeah, I think more people are asking about it than before, whereas before people, like, I think it's just important to know that it's an option, whereas before when I used to bring it up, people didn't necessarily, they didn't necessarily consider it they were just like, okay, move on to the next thing, which is,
Yeah.
What else can you offer? Whereas I think now people are more, or women, I don't know if they just know about it a little bit more. And so they're
I have a
more,
theory. I think it's because when you don't know what you don't know, you think that having reconstruction is, I mean, like a lot of people who haven't dealt with breast cancer, they think it's going to be like a boob job.
Yeah.
So, and they're just looking at it like, okay, well, give me back what I'm losing.
Yeah.
But a lot of women are realizing, that either after the fact and they're choosing to take their implants out, or they're just realizing after they have their surgery that it's not at all the same, that there can be a lot of complications, a lot of issues. The aesthetics aren't what they expected. And so I think it's becoming more of an option because women are realizing that you can't replace what you lost. You're not going to get back, what breast cancer took from them, physically. And so I think it's just an awareness of, what's really possible. And then, I don't know. I mean, that's what I think. What do you think, Sarah?
I mean, I agree. I think people are now searching more and more. I mean, people are putting themselves out there a little bit more. And so when you search breast cancer, lots of different types of images come up as far as what reconstruction or options for mastectomy and what reconstruction can look like. And when you kind of filter through all that, especially when you can lay eyes on your options on the other side of surgery, it can really dictate, I think, how you approach your decisions.
I agree. I mean, I always joke about how much I hate social media, but
yeah.
I mean, to your point, women are, in these private groups and things being very transparent about what they like, what they don't like, what they expected, what they got, and I think that does help women make decisions that they weren't making before. So interesting.
Yeah.
even on like Instagram, like, the algorithm shows you on the feed, like, it'll show you if that's what you're looking for.
Yeah,
like
you search breast cancer once and that's all you see.
Yeah. And so I feel like even there, actually, I think because more women are getting or asking about it, that there are popular, like, not accounts, they're women, but that kind of advocate for why they did what they did and like their story. And I think that is maybe also another.
I think one of my favorite things is to meet a woman who, I look at just the same as me, and she is very much like we've been through the same breast cancer experience. And then I've known her for a long time, and then I'll find out she's flat, and I'm like, wait a second, how did I not know that? Like, and I don't know why I feel like that. It doesn't change my opinion of her, but I feel that she's almost like more empowered, and I look to her like in a different way. Do you?
Why? Because she made a choice that's different than yours?
Yeah.
And you guys had the same thing? And
yeah,
she just wasn't very vocal about it? Or
Maybe because I see so many women being like, look, I chose this, and I'm like showing off my chest, and it's this thing. And then I look at all breast cancer patients, I guess in the same way that when I grew up, I look at everybody and I'm like, we're all the same age. It feels like the equal playing field until I look at somebody. And I mean, it's crossed my mind to go flat in many different occasions.
I think
so. Then when I meet somebody who's like, I'm flat, and I'm like, oh, I could like draw from your experience a little, like tell me what it's like. And,
I think you and I are always interested in people's stories, especially when they choose something different than what we did, because it is empowering.
It is
like
so empowering.
I find it empowering when I meet women that are making different choices than I make, and I learn from them, and I feel empowered by them, because if they can do it, I can do it. And so I think it does kind of send that message, right? But also I mean, women who are flat, they have like, that's the thing. When you go down that rabbit hole, I mean, they'll talk about all the different ways they disguise the fact. Some of them are just flat and proud, and they don't try to hide it at all. Like they openly, other people are more discreet about it. They want to wear patterns, that kind of trick the eye, and they'll go to some length, or they'll wear prosthetics depending on where they're going or what they're doing. They'll go to some length to kind of disguise it, because I mean, really at the end of the day, who wants to talk about their chest with other people? I mean, whether you have reconstruction or not, like that's just not something that you go into conversations with. So I totally get it, but I think that's really interesting. Before we talk about kind of barriers to this procedure, can we do boobs in the news?
Let's do boobs in the news.
Boobs in the news is a fun segment where we read funny tweets by real people or ridiculous news stories.
Boobs in the news, boobs in the news, boobs in the news.
All right. This comes from the Mirror.
That's from the Mirror lately. The last episode was from the Mirror.
I pulled from the Mirror for the last few episodes. So
Mirror is like UK, right?
Mm-hmm.
Oh, okay.
Yeah. So she says the name of it says, my neighbor has 9 cars parked in front of my house, and my response cost them $90,000. So
Her response?
her response, like her revenge.
Oh, gotcha.
Okay,
Okay.
so
okay.
so basically the gist of it is that the neighbors got 9 cars that they park in front of their house, and it's really annoying. And I mean,
Yeah.
I don't know how you feel about this, but in my neighborhood, everybody parks on the street despite having fully functional garages.
Yeah.
And it drives me crazy.
Yeah.
It's like,
Why?
I don't know, because there's so many cars.
Yeah.
It's not.
Well, it's because we're in the day and age where, like, if you have a family of 4 and then you got 2, like, if your kids grow up to you got 2 drivers, then you quite easily already have 4 cars. And then if somebody happens to have, like,
I
show
get it.
car, now you got 5 cars.
I get it. And we live in
yeah.
a chill neighborhood, so people don't get uptight about that stuff. Like, we're not one of those, like, affluent, fancy neighborhoods where they're like, oh, the rules say you can't have any car. Like, some people live in those neighborhoods where you can't have a car on the street. No, but nine seems excessive.
That's quite a lot.
That's a lot. I mean, I might start getting a little bit ticked at 9. So anyway, she dealt with it for a long time, but then essentially they were doing an addition on their house, like the people that had the 9 cars. And she basically called the city and said, I don't think they have permits. And they got fined 9. Like, they had to tear it down, and it cost them basically.
I mean, that was kind of an a-hole revenge.
I know.
I mean,
I don't.
My question, maybe this is the nice person in me to be like, has she gone over there and been like, hey, you have 9 cars and this is annoying?
That's my question.
Before she just cost them
like,
$90K?
I mean, that's the equivalent of being one of those jerks on social media that just says all the mean, nasty comments, but would never do it to their face.
Yeah.
It's like, instead of going to your neighbor and
backhanded.
saying, hey, a lot of cars, can we do something about this? She just she told on them about their addition. They had to tear it all down.
Yeah.
And it cost them like $90,000.
Oh.
So I think the boob
is her.
Is her.
Yeah.
Yeah. I
it's
don't think
sad.
that was. I don't think that was nice.
Yeah, that's not nice.
Anyway, there's your bibs in the news.
Yep. Be kind.
Yes.
Be a good human.
Bibs in the news. Bibs in the news. Bibs in the news.
All right, so we're back. So it sounds to me like you're saying that there are a lot of plastic surgeons that know how to do aesthetic flat closure. It's just really about the patient kind of being empowered to bring it up if their surgeon doesn't bring it up to them. Is that fair, or?
Yeah, and I think part of the thing is when your breast cancer is found, then it's, you get sent to a breast surgeon who then refers you to a plastic surgeon. So I think by the time women get to you, they've just been considering different kinds and they don't necessarily know. But I do think people will talk about it. Like, you don't necessarily.
If a woman is seeing her breast surgeon and she knows she wants to go flat, is the breast surgeon always pulling in a plastics person, or are they taking the lead on the closure themselves if the woman's flat? Like, what's the protocol on that, or does it vary doctor by doctor?
I think that varies more doctor by doctor, but also is definitely patient driven. Like, you don't necessarily need a plastic surgeon to do an aesthetic flat closures. There's definitely a lot of breast surgeons that are good at, aesthetic flat closures, but then some of them don't necessarily want to. And that, I think, also varies by geography within the US as well. But I think if a woman wants it and wants a plastic surgeon to do it and asks for it, I think it's very common.
I spoke to one when I was doing research for these episodes. I spoke to one plastic surgery office that was a private practice, and they said they would never do aesthetic flat closures because the reimbursement's so low. We had a guest prior to you that is the founder of a nonprofit called Not Putting on a Shirt, and she said that part of their advocacy is trying to get those reimbursement rates up so that more doctors are willing to offer it. Do you see reimbursement being a barrier to more women having access to this procedure?
Yeah, I mean, it definitely gets lower reimbursed than compared to other types of reconstruction. But I think that's, this is just like my personal decision, but that's partially why I also practice at an academic institution. So it's not.
She did say that. She said that the academic institutions are going to be much more prone to doing things that appeal to women's quality of life and to procedures like aesthetic flat closure, so for you out there listening, if you're having trouble, if your plastic surgeon's a private practice and they're saying that they don't offer it, the academic institutions might be a good place to go to.
Yeah.
To try to find it. So other problems that patients might encounter in terms of this procedure, it was interesting. Our previous guest had a very specific experience where she asked for a flat contour and then she woke up with extra skin, which her surgeon specifically left in case she changed her mind. Do you think flat denial is a systemic issue, or do you feel like that's pretty rare? And what can patients do to really make sure that they and their surgeon are on the same page? Because Sarah and I talk about this all the time, but when you're traumatized and you're doing all these things at once, things just kind of fall through the cracks because you're just not feeling very empowered. So what do you think about that situation? What can patients do? And
yeah, I think that's kind of hard. I think you always, and I know it's hard because it's such a difficult time in life, but always just advocating for yourself, and then also just trying to gauge if you and your plastic surgeon or your surgeon doing it are on the same page and they kind of understand what you want. Like, you do see them more than once, and you definitely see them before the surgery and just reinforcing, like, this is what I want. The only thing I'll say is that sometimes right after the mastectomy, the skin does take kind of like a hit because you're taking not only are you taking breast tissue with the mastectomy, but you're taking the blood supply and the nerves and everything in the breast tissue.
Mm-hmm.
So I don't know her exact situation by any means, but sometimes people will leave skin just if it looks like the part that they, like, say they were taking extra skin and it would have looked perfectly flat then, but then that flat skin looked a little purple from the surgery. And from my standpoint, like, purple is kind of a bad thing because I want the skin to heal really well.
Mm-hmm.
So that would be a reason why I would potentially leave it, but I would kind of talk to them about why before and after. And it's not, the hard part is that's not your goal necessarily. But afterwards, I would definitely talk to the patient about why I left it, if that ever happened.
Mm-hmm.
The hard part is some of it, to that extent, depends on how the skin looks after the mastectomy. Just to play devil's advocate from a surgeon's perspective. That being said, I do think, if you didn't want to be, obviously, you don't want extra skin when you're looking for an aesthetic flat closure. And so I think just making sure you talk to your plastic surgeon and it feels like they understand you is important, because I think a lot of women don't necessarily know that they can go to someone else or go, that's who they were referred to, but you do have a choice. You can go to whoever you feel comfortable with. And that's for like all parts of medicine too.
We talk about providers all the time saying that, like, you really have to feel like you're on the same page. And if you walk out and you get this like gut reaction of like, I don't feel like they are hearing me, or they don't, like, I don't know, you kind of know when you're clicking with your provider.
I mean,
and if you don't feel that way, then find another provider.
Well, so many women, I'm shocked by this, honestly, because and part of it, I didn't get second opinions for every step of my journey because you're so exhausted and mentally fatigued and you're just wanting to get it over with and do it. And you don't want to delay. So many women are scared about delaying anything because they don't want the cancer to grow, even though that's not really an issue. But, in the time frame we're talking about. But I'm amazed, I'll talk to people who are not happy and I'm like, well, where are you getting your second opinion? And they're like, oh, I'm not. I don't want to make my doctor feel bad. And I'm like, oh, sister friend, don't.
But see, I think that there is an interesting dance because, especially, I guess, in a more of a metropolitan area, you've got breast surgeons that only work with 2 or 3 different plastic surgeons. And if you're within a hospital system, like I've had somebody, like even somebody I'm mentoring right now, she loves her breast surgeon, but she doesn't like the plastic surgeon that they work with. And so
that's interesting.
You're kind of boxed in by like, okay, do I either go with a breast surgeon that I really like and only halfway like my plastic surgeon, or do I find a plastic surgeon I like that works with a breast surgeon that I like, or do I split up my surgeries? I mean, now you're into a whole different, like,
which is exhausting and mentally fatiguing.
Exactly.
And that's why everybody.
So what do you think about that?
Yeah, I was going to say, what do you think about that, Dr. Ebersol? Is that fairly accurate? Are the breast surgeons and the plastics kind of paired up?
To a certain extent. I think not as much in academic places, because I think, but there's definitely people you will work with more often just because of honestly, purely because of location. Like, I operate at certain places and those areas just have one breast surgeon. that's kind of the hard part about that. But that being said, the hard part is you could drive 20 minutes, but if it's easier for you to go to this place and that's where your like breast surgeon and oncologist and radiation oncologist is, like, why would you go somewhere else? But it's not necessarily a pairing, but it is like, there's definitely people, like, you definitely work with certain breast surgeons, or breast surgeons work with certain plastic surgeons, just because they kind of have their flow together, if that makes sense.
Yeah.
Mm-hmm.
Yeah. It's just something for women to be aware of, right? I mean,
Yeah.
like Sarah said,
Yeah.
it does present a little bit of a quagmire if you like one. And
I think the other hard thing that you guys mentioned is, by the time you get to a plastic surgeon, I think you've had so many consults with so many people.
Yeah.
And then you're just like, do I even really care? But, you do care, but I think people don't really.
When you care is when the dust settles and you're in survivorship, and then you're like, I would have done this different and this different. But at the time when you're just running around like a crazy person, that's the hard part. So it's a dance, and you just got to figure that out. So, okay, well, interesting. Before we wrap up, let's hear from our second sponsor.
Innsbrook Resort is a proud sponsor of the Faith Through Fire Respite House and the Besties with Breasties podcast. We know you work hard, but at Innsbrook, we also know you want to disconnect from what's stressing you out and reconnect with the important things in your life. Innsbrook makes it easy by offering lakefront living and vacationing less than 45 minutes from St. Louis. Vacation homes, golf, swimming, nature trails, fun events, and more. Take a drive and discover Innsbrook. Visit Innsbrook-resort.com.
And we're back. So, Dr. Ebersole, do you have any last advice? First of all, where can women find you? Because you do aesthetic flat closure. This is a procedure that more and more women are asking us about. So where can they find you? And then any last advice for women that are considering the procedure?
My Instagram is at PlasticsMD, but in terms of my office, I have clinic both at Barnes West County and at Barnes St. Peter's. So you guys can look me up on the WashU website for Washington University in St. Louis School of Medicine and book an appointment online or through the phone through there if you want to. And then the last thing that I just wanted to mention, if it's okay, just because there's women who are considering an aesthetic flat closure after having their breast reconstruction previously.
Mm-hmm.
And I think that's a different kind of treatment algorithm in my mind, because implants or previous even treatment from breast cancer with radiation can thin the skin to a certain extent. And that's just something to know, that other parts of your treatment can affect the aesthetic flat closure.
Mm-hmm.
So that's just one thing that is kind of patient to patient dependent, but just finding someone that knows and understand your history and knows kind of what they can offer you. Each patient's different, so it's a little bit hard to just contextualize everything on one episode, but
Sure, totally.
Yeah. I mean, the bottom line is that, I hear what you're saying. If you've already had reconstruction, you're considering explant, but you've had radiation, that's radiated skin. That always opens you up for complications or other considerations. So super important to have that consultation and that one-on-one discussion with your doctor, and just tell them what you want, and then they're going to tell you what they feel like they can realistically give you.
Yeah.
And then you can choose to go that route, or you can get a second opinion. But ultimately, we just wanted women to know that it's available and that you're providing this service. And we really appreciate you being on.
For sure.
Yeah, thank you guys so much for having me.
Absolutely. Until next time, guys.
See ya.
Thank you for listening to the Besties with Breasties podcast. Leave us a voicemail or share your own experience on bestieswithbreastiespodcast.com. And don't forget to leave a 5-star review. This episode was hosted by Sarah Hall and Beth Wilmes, audio and production edits by Innovative Frequencies.